engaging in midwifery politics. I love it. I'd like to welcome you to the Midwifery Advisory Council meeting. I'm Carrie Sparavon, the chair of this committee. I'd like to take this opportunity to remind everybody to please put your cell phones to vibrate or turn them off so that they don't disrupt the meeting. We are not being webcasted today due to staffing limitations, but the meeting is being videotaped and will be available on the board's website following the meeting. If you'd like to provide public comment, please fill out a speaker slip in the back and give it to Ms. Morrish. There she is. All right, I'd like to now call this meeting to order. Ms. Lowe, would you call the roll, please? Dr. Byrne, Ms. Ehrlich, here. Ms. Gibson, here. Ms. Webster, here. Ms. Jaroslawski, Ms. Sparavon, here. Thank you. I'd like to take public comment now on items that are not on the agenda. And just be advised that the committee can't take any action on anything you bring up today. We can only hear it. The only action we can take is to agree to set it as an agenda item for a future meeting. Is there any public comment on items not on the agenda? Seeing none, we'll move to our next agenda item, which is approval of the minutes from the August 30th meeting. At the December 6th meeting, there were some items on the August 30th minutes that some of the members felt needed to be changed, and Ms. Ehrlich was going to take on that task. Unfortunately, she only got to it a week or so ago, and so I understand it's been completed, but the staff doesn't actually have it in their hands. So I'd like to entertain a motion to table the approval of the August 30th minutes.
So move.
Second?
Motion table this.
Okay. So, anybody opposed to table?
I just was reading it and had a comment. I hadn't read it before.
Okay, I take public comment now then. This is August 30th minutes.
Yeah.
Okay.
Actually, on page 6, I think it says the opposite of what I meant. On the very last paragraph, it says, Ms. Smith-Crowley, let me see, second to the last, I'm sorry. Second sentence, it says, she has not found anything that says a physician cannot supervise or consult, collaborate, or have backup. That's actually not true. That's the language I've been using as I've been saying the policies I've seen specifically says a physician cannot supervise, collaborate, consult, or backup, and that's the problem about why just removing physician supervision would not be sufficient to deal with the ability of physicians and midwives to work together.
So as far as a correction to the minutes, would it be appropriate to say not found anything that, take that part of it out and then the rest of the sentence reads correctly?
Yeah, that she is, but we found that a physician cannot supervise, collaborate, or backup.
So take away not found anything.
The word starts with that. That's not found anything that. Just
Yeah.
take that out. And what she says a physician cannot supervise.
Oh, I see.
And that, and I do not believe removing physician supervision. I think the way I remember saying it was that I don't think I said that removing physician, the word supervision was problematic as much as removing a physician-midwife working relationship, was a problem, that we needed to do whatever we could to make sure that there was a continuing working relationship regardless of the actual definition. So I can rework that and maybe come back to you if you would like.
So I want to ask a question. I understand you've tabled the approval of the minutes, but could we go through there and see if there are additions or subtractions to the minutes as they are that would give voice to them now, so that staff would have a direction of any other corrections?
Certainly.
Is that okay?
Actually, staff would prefer that we do what we said the last time, is to provide them to staff, and then they'll present the minutes with
The
those
next meeting.
corrections at the next meeting.
Yes.
Watching the public, I mean, they can take those right now.
So, is there any other public comment on the meeting minutes from the August 30th meeting last year? Okay. So, this item then is tabled until the August meeting this year. Item 3B is the approval of the minutes from the December 6th meeting. Is there any public comment on those minutes?
I have some, I'm not a public, but I have a couple of minor changes.
Okay.
On page 8 of,
It starts on page 19, so I know where.
say that again, please?
It starts on page 19.
Thank you. Okay, page. It is page 26 of the packet, about slightly more than 1/3 down, almost to the middle of the page. It says the Midwifery Education Alliance in California. That is incorrect. It is the Midwifery Education Accreditation Council. That is what the acronym stands for. Then on the next page, in the third bullet down, the sentence, "This lowers the possibility of incomplete data and inquiries by the medical community." I believe that should be criticism or skepticism. I'm not sure exactly which, but just inquiries by the medical community really is not significant. It's got to do with disbelief in the data.
So skepticism.
Skepticism would, yes.
What term are you proposing, Karen?
Say that again?
What term are you proposing?
Skepticism instead of inquiries.
That's coming from what I said, so
The sentence doesn't make sense.
yeah, it doesn't, and it's not the way I wrote it. Let me see if I have the actual wording that I said.
Okay, I know that I was hoping to be able to see the webcast or the tape of this meeting in order to run through the minutes, and I couldn't find it. I know it says it's on the website, but in the place where I have seen it in the past where there's a link to the tapes, I didn't find it. So I did not compare my memory of the meeting with the actual tape on this one.
Well, for both meetings, the broadcast is on and
I'm saying I couldn't find it. I looked and it had agenda items, but it did not say, here's the link for the tape or for the webcast.
They're not currently listed on our website under meetings, but they are available through DCA's archive of webcasts. It's also on YouTube, so I'll work on
I
getting
also
those.
looked on YouTube, and it would not come up. The only one that I could get to come up was the August 30th meeting. I couldn't get the December 6th meeting to come up.
I will have those posted
Thank you.
very quickly.
All right.
Okay, but it's my opinion that that kind of information needs to be on the medical board website as to how to
How to
access
access
the
it.
meetings that we are overseeing.
And
Absolutely.
I believe there was, at some point, where the committee where meetings of the board and committees are listed, at some point there were links there if there was a webcast so that we could go directly to the tapes. And it isn't there.
So that's, okay, that's,
So I think that should be changed.
you have what you have.
Yeah, I can't find the actual wording. I've got it at home, so I'm fine with the interpretation that's been made. It's sufficient.
So then is the change skepticism of the data?
This was
It,
skepticism.
well, it really, to my way of thinking, it really is inquiries by the medical community. in terms of, why is the data complete or isn't it complete, and is it accurate or isn't it accurate? So,
If you want, since you said it and I couldn't find a tape, I'm happy to accept that. It didn't make a lot of sense to me, which is why I thought that it should have a different term.
yeah, I think I'm fine with it.
Okay.
Okay, so we're gonna take out skepticism, leave inquiries.
Yeah, just leave it the way it's worded.
Okay.
Okay.
Right. Okay.
Is there any other corrections?
Yeah, Ms. Dobbs?
Yeah, I have one other minor correction. On page 20, the second bullet, the very last line should read, "It is prohibited to have two council members in discussion with additional people in an effort to reach a majority consensus outside of a publicly noticed MAC meeting." And then the second to last paragraph, the very last, I guess the second to last sentence, where it says they are speaking, it should be as individuals and not as members of the MAC.
And that's it. Anybody else have corrections? All right.
Wait, what is it? It doesn't, it's not what it says now?
It says individual and member rather than individuals and members.
It makes the grammar better.
I was trying, I saw the words, but I didn't look at it.
All right.
Sorry, I tried to anyway.
All right. So do I have a motion to accept the minutes with the corrections?
So move.
Second.
Any further public comment? Seeing none. Can I have a vote then on the minutes? All in favor?
Aye.
Aye. All opposed? Great. Motion carries. Next agenda item, which is my personal report. Just brief, so I won't bore you guys for a long time. At the medical board meeting in February, end of January and February, I presented the concept of adopting the Manastats project as a data collection tool for California midwives, and there were good questions. It was well received, and the board wanted to go ahead with exploring the idea of possibility of seeking a statute change to incorporate Manastats. Monday, we were at the Sunset Review at the legislature in Sacramento, and several of us spoke, and the Assembly member and chair of the Assembly Business and Professions Committee, Richard Gordon, was really positive in his closing remarks, mentioning the midwife-physician relationship as something that needs attention, which we all know. I'd also like to take this opportunity to say thank you to everyone that's shown up, but particularly the midwives that are engaging in the dialogue and the process here, both CNMs and LMs. And I'd like to really encourage you to stay involved, contact your state organizations, see what work you can do, because as we move through the legislative process this year, there are going to be changes. And the only way that we can be sure that we get the changes that are appropriate for our licenses and for the public that we see is to stay involved, as your input and your energy is vital. All right. Anybody want to comment on my statement? Okay.
I'll second that.
All right. Agenda item 5 is the Sunset Review update. So I'm going to invite Ms. Lowe to update us, please.
So a little background information. A copy of the original and supplemental Sunset Review reports as they pertain to the midwifery program are available in your packets and can be found on page 30. As most of you are aware, the board submitted the original Sunset Review report to the Senate Business Professions and Economic Development Committee of the Legislature in November of 2012. The report identified several concepts concerning the practice of midwifery, including physician supervision requirements, lab orders, and obtaining medical supplies, and midwife students, apprentices, and assistants. Since the last MAC meeting, a supplemental report was submitted to the legislature, which included additional midwifery concepts, such as adding certified nurse midwives to statute to allow supervision of students and the use of MANA for reporting purposes. Items 5A and 5B on the agenda, the status of the proposed adoption for language for physician supervision requirements in the practice of midwifery drugs and devices, was included on the agenda today to provide an update that the language that was originally proposed was no longer moving forward as a regulation change, but the concept was being added to Sunset Review. The information pertaining to those two items can be found starting on page 44 of your packets, and it's the language included in the Sunset Review report. The hearing was held this last Monday, March 11th, and the purpose of the hearing was to allow the committee to obtain additional information from the board following their review of the reports that we submitted. Although the issues pertaining to midwifery practice were not discussed by the committee extensively, several members of the midwifery community did appear and provide testimony, including Ms. Farvon, Ms. Gibson, as well as Constance Rock with CAM and Ms. Shannon Smith-Crowley with ACOG. Information that was provided by the public would be taken into consideration by the committee. We'd also like to mention that Ms. Smith-Crowley did make a very positive statement during the hearing regarding midwives, stating that ACOG does have physicians that are willing to work with midwives, but that they're currently unable to do so. ACOG is going to be sponsoring an Assembly Bill, AB 1308, I believe, to address the issues of supervision as well as billing issues for midwives. And the board does look forward to working with ACOG to get that going. Following the hearing last Monday, it's anticipated that the board will receive written feedback from the committee with additional questions. If that is the case, we will need to be prepared to answer those questions, and we anticipate things like using MANA or the approval of MANA for reporting purposes will require additional information, such as who will be responsible for paying for it, how that money will be generated, as well as what data MANA would be collecting and how that data would be transferred to OSHPD. So those are things that we'll need to consider and be able to determine. As we get additional information on the Sunset Review, we'll be forwarding it to you and providing updates. But as of right now, the hearing is the last thing scheduled at the moment, so we will wait for word from them.
So, Ms. Lowe, you were talking about the next meeting of the Sunset Review from the legislature. That it's a follow-up hearing that they will hold, or this is something that the medical board will hold?
At this point, there is no further hearings scheduled. We are anticipating that they will respond back to the medical board with written inquiries.
Mm-hmm.
Once we receive that, we'll move forward with providing the information, but there's nothing scheduled further at this time.
Do we anticipate that there will be another hearing scheduled, a follow-up hearing?
Well, that would, we don't know that for sure, but if they do send us back information, I know that one of the things that the board members had brought up at the last board meeting was they were interested in knowing how we would pay for MANA and where that money would come from, and actually the cost of MANA. So we had estimates, but we probably should be working, asking MANA to give us a little more finite costs in case we get asked for it.
So more of a line item
Yeah.
budget from MANA?
So that is something we might get asked from. As Ms. Lowe said, with the committee was very receptive to the issues of the midwifery community, and that they understand it needs to be fixed, and so especially the physician supervision, that was one of the things that they focused on. So I think and I've been around midwifery for quite a while, just my second term here, but this was the most positive thing I've ever seen happen towards that step being fixed. And so I was very happy with how they perceived the comments from the midwifery community and from Ms. Smith, Crowley, from ACOG, knowing that, yes, there are doctors who would like to work with midwives, but are actually sort of prohibited based on their insurance requirements and that kind of stuff. That seemed, they listened to that, and I think that might be the first time they've listened to that for a long time. So it was very positive for the midwifery community.
Absolutely.
I think that we all have to be cognizant of the fact that there is a wave now in the state of California, that there is an understanding that other people are going to be doing other jobs that are not necessarily doctors. And we're going to have to share responsibility, and there's going to have to be some kind of expectation of mid-level practitioners. And I'm not suggesting you're mid-level, because I don't know what level I would put you at.
It
So
works.
but if you want to suggest it's a mid-level, I don't know. But we need to understand that, and I think the legislature is very cognizant of the fact that this is going to exist anyway. So let's get on the train, it's moving forward, and let's get all on the same page. So I think that what you're hearing from Kurt is absolutely a very good representation of what happened, of the positive nature, and not just in this field of the practice of healthcare, but in many, and the legislature is very interested. So.
Absolutely.
Okay, just to add a little bit more onto the sunset process, the next thing that you will see is a bill that will come out which extends the medical board, but that will also carry several of the items of the sunset issues in that bill. We may also see a separate bill as well for those. Obviously, you don't want to put the controversial issues into the board sunset bill, so we may see another bill as well coming out from the sunset. So then the hearings for those bills will be the next step in the sunset process.
What's the time frame on that? Do you have any idea?
The bill actually may be out already today. I haven't checked it yet, and unfortunately our chief of legislation isn't in today, but just for the extension and possibly for some of the language, it should be out there probably within the next week or two.
Well, if members of the community want to find that,
If you go to www.leginfo.ca.gov, you can just actually search for a keyword of medical board, and it should pop up. And as soon as we find out what the bill numbers are, Carrie, we can actually send that out to you guys.
That
so
would
you
be
can pass it out
wonderful.
to the community.
That would be great.
That would be really great.
So let me ask you a question with that, would be very helpful, that in addition to, if the sunset review is going to come back with questions, is the sunset review currently the submission that was made Monday on the medical board website? Should it be? And if so, would there be the follow-up also on the website?
It is not on the medical board's website. You would go to the Senate website,
Senate,
and
okay.
it's Cal Channel. They actually direct you to Cal Channel. So you can go out there and see it. The questions that we actually will receive from the committee, we've already received them. It's the 39 issues that we have to respond to. So we have 30 days to respond to those issues, which include the midwifery issues as well. So those will be the ones we respond to. Anything else, any other types of questions will probably only come up at the hearing.
So, sorry, right over my head. I'll think of it later and I'll have to ask you things.
All right, thanks.
Ms. Smith-Crowley, some comments?
Thank you. Again, representing the OBGYNs, and I think most of you on the MAC understand what we're doing, so I'm saying my comments really for a lot of the people in the audience to get them up to speed. We, like everybody in the room, are very frustrated about the amount of time that we're spending on not able to fix the system and improve care and reduce the hassles for midwives and patients and the on-call physicians. And we'd like to protect the physicians that are working with midwives right now at their own peril in terms of any liability. We don't have all of the solutions right now, but we went ahead and sponsored a bill with Assembly Member Susan Bonilla, mother of 4, last 2 born with certified nurse midwives in a hospital. But she really wants to have this be a collaborative effort. And the reason why we sponsored a bill, even though there's the Sunset Review bill, maybe more than one, is with all of the other issues that are part of the Sunset Review and the need to really put some concentrated time into this, we wanted to have our own bill so that we could really use this as a focal point and a way to pull people together to have conversations. There's a real impetus to get this bill through this year. Normally, we're the first year of a 2-year bill cycle. Normally, we would have 2 years to get this resolved, but in this instance, we don't, because the medical board sunset review bill is going to have to be done this year, and basically the bills will work in tandem. My expectation is that if there are things that we are able to agree on that go into AB 1308 and don't need to be addressed by the board, either they don't need to address them, or there's a process of reconciling the bills later on in the process. So even if we have the same language in both bills, it'll get resolved through a technical process. So the timing right now is the bill is in the Assembly. It'll be heard in the Business and Professions Committee probably in April. And it needs to get out of the Assembly by June, I think it's 6th. So in the next 3 months, there's a lot of things that we'll work through, including liability and outcomes reporting, and a lot of the little things should be easy in terms of the drugs and devices and ordering that, but the more complicated issues in terms of liability and supervision and outcomes, I think a lot of the results, what we would put in legislation, are things that we'll know the answers as we work through the different issues. Now, we won't be able to work with the Midwifery Advisory Committee, separately because of open meetings laws. I'm very cognizant of that. But I think we can work with CAM and the nurse midwives to have some different work groups on issues such as the outcomes reporting. I just talked with Constance and Sarah earlier about there's, I think, a lot of positive openings to talk about the liability coverage with the Department of Insurance. The Department of Insurance, the commissioner is very plugged into the Affordable Care Act and all of the components of that, which also includes covering midwife care, but would also perhaps be able to work with the federal government on getting ACA monies to help fund some sort of coverage pool, grant monies that exist for improving maternal outcome and for looking at different models of liability coverage. And the reason why I keep focusing on liability is that, well, 2 reasons, is we need to figure out we need to make sure that physicians are covered for when they work with midwives and out of hospital patients. And because we need the relationship to be above board and not be behind the scenes or don't ask, don't tell. And so however it turns out that the liability works, that will really probably dictate how we define the working relationship between the midwife and the physician. But probably as importantly is that, as the midwives that testified at the Sunset Review hearing earlier this week, was the importance of making sure that midwives themselves have liability coverage so that they can participate as Medi-Cal providers and contract with managed care plans. And without liability coverage, that's impossible. So we need kind of this dual prong.
Can I ask you just a question on that, Shannon? With the ACA money, will there be the biggest problem for midwives doing home deliveries is cost of the insurance, and it's been cost prohibitive for them. With the grant money and stuff with ACA, do you foresee that vanishing as an issue? My understanding is essentially, it's very superficial right now, and that's one area that needs a separate group to look at it, but understanding that that is a limitation, so there needs to be some, even if there's ACA seed money, there needs to be some perpetuating system, and whether it's, per birth or looking at what other states do. And part of it also is
midwifery income may change if midwives are able to contract with managed care companies, not necessarily if you're a Medi-Cal provider. Income may not change, it may go down.
Exactly.
But, editorial comment there. That, again, a lot of this the rest of it will flow from how we can decide that it's basically can be a legitimized relationship. The other aspect that would be at least a partial or a temporary fix is I'm talking with the University of California, as they cover a lot of the state between their medical schools and their residency programs. They're a self-insured entity, and they're known for innovation. And so far, there's some very preliminary, very initial interest from UC. There's actually some potential grant money for looking at innovative relationships. And there are people, and we're going to talk with OBGYNs at the different facilities. For instance, I just talked with somebody at UCSF who's chomping at the bit to be able to have a more, a more above board working relationship with midwives. So again, a lot of those things, the liability issue, how things would work for UC, they're going to help inform our final decision about how we define the relationship. The other thing, a big area about working on is the outcomes reporting. And we are, again, have another work group, not MAC, but with people in the room in terms of working through the idea of we would like to propose something along the lines of Vermont, where there's a dual system of the state reporting and MANA. And it's any day now is supposed to be the first MANA report, so we can see how Vermont, how it's playing out. And what I liken it to is the MANA system is your checkbook you fill out, hopefully every time you write a check. I sometimes forget. But then you use the checkbook to fill out your taxes, your annual report, which is the OSHPD system. There are things that you need for the annual report that aren't part of MANA. Can you
identify what those are?
Well, and see, this is another thing where the physician supervision and liability, the issues will come into play is because one of the things we ask is about physician relationships.
Right.
And so
but we've already collected that data. We already know what those relationships are.
Well,
so
and
moving
again,
forward, maybe we just don't need that.
Well, and in Appendix E, I think, of the MANA report, they listed out actually yes, a number of items, including the reasons for transfers not contained in the summary document. Multiple births are all listed together. Twins are not separated out. Reasons for death are not captured in the summary. And as half of midwives are already using MANA, it seems like to go where Vermont went with saying have everybody do it. And I have some questions also. I don't believe there's a cost for the midwives to, or is there?
There's no cost to join MANA, no.
Right,
or to participate
in the system.
No, there's no cost.
Is this a discussion that maybe you should be forming some sort of
right,
like a small task force, a small group, you and
right. We'll be careful
Yeah.
because we want about forming a task
that's
force
the
in terms
problem.
of open meeting.
Open meeting.
But the other thing
is you can
have one of us.
We could
okay.
we could form
Okay.
a task force that's as part
work
of the
group,
MAC, a work group.
The couple
Right.
two other things that are occurring is there's actually some interest from Department of Public Health has a very robust and increasingly improving maternal outcomes reporting system. And there's the California Maternal Quality Care Collaborative and the California Perinatal Quality Care Collaborative. And actually to bring in your data into that system is something that and also bring in some of these people who have fresh eyes, who's not seen it from the OBGYNs or the midwife's eyes, but from somebody who's more
Quality
neutral
care.
and fresh there. The other thing is looks like I wish we'd been able to go, a really great 2-day workshop that the Institute of Medicine just put on, was that just last week, on research issues in the assessment of birth settings and looking at what data should be considered. And so there's a lot of things that are in play.
Right.
So to commit to any particular system right now, it seems like if we fixed some of the problems with the OSHPD system, and we need to, I'll talk to Manna about part of it, is to help the midwives when they fill out Manna, then take that information and not have to recreate it, and fill out the OSHPD. We want to have the questions close, to each other as possible. For instance, are there copyright issues? I do not know. So that's the kind of thing, that we'll look into.
My biggest concern would be that we'd have two reports that didn't agree.
Yeah.
But that may be useful in terms of helping us find, and that's, let me back up. One other thing I would propose as part of this is we can even say, let's have it work for 5 years, and we have it even in statute to evaluate and get those things worked out, because seeing those discrepancies will help show issues in either system.
So I'm hearing that maybe we do need a work group or a subcommittee. So before I propose that, I need to know if there's staff time for that.
For us to run a work group right now is very difficult because of our other commitments with staffing. And I'm not sure how soon you need that, so.
Well, as we're going forward with legislation, we probably need it sooner rather than later. If there are no MAC members on this work group, then they can do whatever they want, right?
Even one.
You could have one.
One midwifery council meeting member could be on any group.
Can I interject here for just a second? I'm planning on retiring from the MAC today, so that way I could participate without being violating the open meetings.
You can stay on the MAC and still participate.
Yes, I mean,
I understand, but I'm still
permitted, and that
retiring
would
today.
not meet the definition of a meeting. So one
Right.
person.
But the timing of this is that we really need to work through, I'd say, by the end of June, where we're going to be, because then, by then, the bill is going to move over to the Senate side, and I think we're just being referred to Senate Business and Professions, not to another committee. So we need to know where we are by the time we go into the Senate Business and Professions Committee, or we'll have limited. You're still able to continue to make amendments through until practically the last minute, but in terms of really the substance, we need to have it before the committee for the Senate Business and Professions Committee. That could be June or August.
Okay, so I'm going to charge you and the leaders of CAM with making that happen.
Can I ask you one question? Is the system that you've just described, does that allow for confirming data, such as if there's a neonatal mortality, that we would know for sure that it occurred, as opposed to just right now with OSHPD can't actively confirm anything or validate it?
I would hope that we would be able to do so, and actually I think the Department of Public Health, their role in this will be very helpful, because they will be able to help, I think, tie in systems, and also if we need things like a vital records change on the birth certificate or any other things like that, they should help be able to facilitate recommending certain changes within the administration.
So let me be the elephant in the room and ask you the question. Is what you're doing on a go-forward basis hindered in any way by having a whole lot of additional help?
You mean the fact that there are 24 hours in a day and only?
No, if that's the way you took the sentence, that's fine.
that I'm one person and
That's not the way I was taking the sentence. I think other people got what I was saying.
Okay.
I just want to make sure that it sounds like everything is moving, somehow everything seems to be coming together and gelling. Things are going in the right direction. I just want to make sure that nothing stops what you're doing. At the same time, I don't want anyone to be left out of the process, but I'm afraid that somehow there has to be some management of collaboration.
Thank you. No, I understand what you're saying, and that I'm looking at how I need to have a point person, and I'm working with Constance Rock, and I'm going to lead for the licensed midwives, and going to include Kim Dow for the certified nurse midwives, and I think Yvonne Chong is in the room from CMA. And so I'm going to need to have them help bring in and educate all of their people, because you're right. I'm going
So
to be
you're driving the
limited.
train, is that what I'm hearing?
I'm driving.
Yeah, I want to
driving
make
the
sure everyone
train.
understands that you're
Right.
driving the train. That's
Right.
where I was trying to get to without saying
Right,
that.
and that the hope is, as much as possible, to put everything into the bill on a collaborative manner. When we get to the Senate, there may be some push that comes to shove, and there may be some things that we want that the midwives don't. I don't know. I'm hoping that, again, through the process, that
Okay,
we'll
let's see
be able
what
to come to the right
ends,
answer.
let's see what ends up. I mean, maybe the end of May, let's have a conversation.
Okay.
Thank you, Shannon. Yvonne Chong?
Good afternoon, Yvonne Chung with the California Medical Association. I think that we are in support of just about everything that Shannon Smith-Crowley mentioned with respect to supporting the need for a subcommittee. I think that we've had conversations with ACOG, and I feel like we are moving in the right direction. I think a subcommittee is important. I think our concern here is that we want to make sure that we don't do what's easy, we do what's right and take the time to do it right. I think sometimes we try to be hasty and just say get it done, but I think as we've seen, sometimes you don't actually get what you wanted. So I think what we want to do is really to help develop it as, you know, it's viewed as a very legitimate profession, and bring it more in line with what everybody else is doing in terms of reporting requirements, helping to define collaboration. We're working with the AMA. Not necessarily just with midwives, but with other allied health professionals in defining collaboration and consultation, and we're starting to look at different definitions and trying to figure out how that would work, particularly with respect to liability issues as well. And that is something that unfortunately, we don't have a lot of control over, but I think at least what we can help do is help to frame the conversation and say, what's possible, what's not, and what we're really hoping to do is develop a very long-term solution that will work for the midwives and work for the physicians and work for the public. So we look forward to working with you. Thank you.
Thank you very much. Is there any other public comment?
No, but of course there's a legal question.
Oh, all right. Go for it.
There is public
You just
comment.
wanted to talk, I know.
I'll defer to that gentleman over there, or whoever's, I can't see, or, sorry.
Who's got public comment out there? Please
Sorry,
come forward
apologize.
and speak into the mic.
My name is Judy Tinklenberg, and I'm a nurse midwife, and I've been in practice for quite a while in the Bay Area. I've just relocated to Sacramento, where I'm opening a birth center in conjunction with a managed care Medi-Cal company.
Yay.
Yay. And working with Carrie. A couple things come up for this. First of all, one of the things that my CEO is trying to do is figure out how to get our midwives who are going to be doing out-of-hospital birth malpractice insurance, public liability, or whatever you want to call it, medical liability insurance, professional liability insurance, and is trying to do it under the arm of their self-insured Medi-Cal, the Medi-Cal managed care company, Cinermed. And I've had questions. I don't think he understands that this may be kind of a complicated mess, but if it turns out that way, and if it works out that the midwifery people, that midwives can become part of managed care Medi-Cal organizations, there may be some relief in terms of that. But my main comment is, anybody who knows me knows how much I hate computers and how much the whole concept of electronic medical records threw me for a complete loop. But one of the things that's come out of this process is the company that we're working with, Athena, the managed care Medi-Cal company that we're working with, actually has the method of collecting all data that we can set up the templates. They can set up, to collect all data as we enter things, and then use them for whatever database ever, if you're going to use
Statistical analysis or whatever.
or statistical analysis, and make it easier to do it, as opposed to trying to do a lot of it by hand or have your students or somebody else figure it all out for you. And I think after moving into electronic health record being kind of the standard of care, I think everybody should consider that as a way of making it easier to collect the data, regardless of what system you would choose to use.
Thank you.
That's just an opinion, but
Thank you. Is there any other comment on this agenda item? All right. Tanya?
I also have a comment.
Hi. Good to see all of you. Tanya Brooks from Los Angeles, president of ACHI, and I've been a director of a freestanding birth center for 28 years. I'm very concerned about double reporting to MANA and on the midwifery reporting. I think both forms do not give us the data we need. Both are too complex. And many years ago, I presented the data collection from PACLAC, Perinatal Advisory Council of Los Angeles, which is simple, it is comprehensive, it's fast, and I think that that should be relooked at. Perinatal Advisory Council has gathered data from all of the Southern California hospitals and out of the hospital practices for OBs for years. I think it's something we need to relook at because as we make this more and more and more complex, it takes more and more time of committee members and everyone to work on language, to get it right, and so forth. And I think it's worthy of looking at other things. The MANA form is complex. My husband's a statistician. He was a professor of quantitative analysis at USC, a mathematician as well. And when you look at these forms, the real purpose of these forms, is it not, is to gather data about so that we can make things better for patients and long-term outcomes are improved by the quality of the care that we give. Isn't that the real purpose of that? So when we make something so complex where we take enormous amount of time to implement it, to drive it, and make it very expensive, I think it's counterproductive. So this is something that, number one, I recommend we relook at. Second, it would be very helpful to me as a researcher and a scientist to get a very clear picture of what data is missing from the form that we're already reporting on so that I can understand. And I already presented and had my reservations about the form that we report to the State Health Department every year. I thought it was too complex, it's too confusing, and you're right, it doesn't divide out twins and multiples, and it's not clear about outcomes. And those are the major things we need. So that was the first comment that I want to make. The second one is I really want to remind everybody to keep it simple. I won't say the last yes, but it really has gotten, as we have like 2 bills coming out of this sunset thing, I think we really need to look at this because what I want to see is something go forward that is effective, that allows midwives to integrate into the system so that they can take their rightful place in handling. And I'm sorry, I forgot who said this, but I was very offended by the comment to make midwives a legitimate part of the system or whatever term was used. Midwives have been the system worldwide forever. We're not an illegitimate sister of the system. Midwives are out in the front lines every day delivering babies. And I want to remind you guys of one other comment that has relevance here.
Okay, we need to stay with the agenda topic.
I understand that. But I want to say this, Carrie. When we tried to get midwives licensed so many years ago and we set up the system, I contacted every California school, everyone without exception, and I asked them to put training programs together for midwives so that we could standardize the care and so forth. Not a single nursing program or college in this state would educate the midwives.
Yeah.
So that gave rise to all of these comments that were sort of implying we're not legitimate and that kind of thing. This needs to change, and it needs to be any writing that's done needs to be very simple, but it needs to start from the standpoint, especially when we're talking about this sunset, it needs to start from the standpoint that midwives are going to stand regardless of what we do. That's it.
Can I ask you one question?
Yeah.
Is it possible for us to get a copy of the perinatal,
the statistics form from PACLAC? Sure, and
yes,
I actually
PACLAC.
presented that a long time ago,
Okay.
but I'll drag one out. Yeah.
Thank you.
Yeah, thanks.
Did you have a comment, Faith?
Well, are we still on the general agenda item of the sunset review?
Yes.
Is that where we are?
Yes.
All right. I just to set the record straight, I want to point out one sentence in there that I want to explain a little differently. This has to do about supervision. It's on page 45. It's the second paragraph or the full paragraph. About midway through, there is disagreement over the appropriate level of physician supervision, with licensed midwives expressing concern with any limits being placed on their ability to practice independently. I want to reframe that our issue is not that we want to be cowgirls. It's that we know what works for childbearing women. We have to have a midwifery licensing mechanism that actually allows us to meet the needs of childbearing women, so that we do not recreate either lay midwifery or increase the number of women who find themselves having what they artfully call do-it-yourself births, which is unattended births. And so it's not that we just want to be able to just, wear purple hats to births, but we do need the relationship between midwives and physicians has to work for all of us, including the taxpayer. Thank you. I'll get off my soapbox.
I'm in agreement with Faith on that, but I think that the sentence, and when I read it the first time, I felt that, similarly, that there's nothing about the process that we're engaged in now that midwives want no limits on their ability to practice. It's about wanting safety. It's about wanting ease of transport when we need to transport. It's about wanting ease of consult when we need a consult with a higher level care provider, whether that be an obstetrician or a perinatologist or a neonatologist or whatever. And the way that it's worded here, it makes it sound like, we just want to do whatever we want to do and we don't want any limits on that. And that really isn't a good characterization of how midwives view themselves as practitioners. So, thank you. Is there any more public comment on agenda item 5 or comment from the council? All right. Yeah. Okay. We're good. All right. Since there's no further comments, we'll move on to the next agenda item. Ms. Lowe will now provide an update on the midwifery program.
Prior to getting into the statistics on the agenda items, a couple of updates is at the last MAC meeting, an update on the task force was provided for the student assistant, and it was asked that staff provide an update at today's meeting regarding the areas that were identified in the task force and possible regulations that could be changed. We just want to give you an update that as this is being included in the sunset review, we'll be awaiting word from the legislature on what action they'll be taking or how we should be proceeding. So at this point, no further actions will be taken by board staff. Also an update on the NARM exam. The board hosted a NARM exam here at our headquarters on February 20th. There were 8 individuals that sat for the exam, and the next exam is scheduled for August 15th. Good. Agenda item 6A. If you could refer to tab 6 of your packets for the licensing statistics for the second quarter, and that would be a fiscal year 2012-2013, which is for October 1st through December 31st. We show that 12 new applications were received, 12 licenses were issued, and at the end of the quarter, 286 licenses were in a renewed current status, 24 were in a delinquent status. We've also provided additional statistics in the chart for your reference and review. We also provided you with an updated copy of the statistics that everyone should have.
I have a question about the midwives in delinquent status. I know another midwife and I just yesterday were looking at a couple of people, and we know that there is at least one midwife who is listed as delinquent who's actually deceased. I realize that we were told that the only way to get that changed to deceased in the listing is for a death certificate to be sent to the medical board. When you have a midwife who is long delinquent, is there any method of being able to have the medical board try to find out what's going on with that person? Or could we, as the Midwifery Advisory Council, be empowered to get that midwife's contact information so we can try to find that out and get it properly updated? It's really hard to look at one of our friends being called delinquent who actually is no longer with us.
Okay, so there are certain procedures that we have to follow
Right.
to update the records, but if you have the name of someone, we can attempt to look into it further and try to obtain that information.
Thank you.
At the same time, if we're unable to verify the information, the license would stay in a delinquent status for 5 years from the expiration date and would then show canceled. But if you want to provide that to us, we'll look into it.
Thank you.
Can't you get I mean, you are a state agency. Can't you get information as to someone's death?
We do attempt to do that.
Okay. That is public information.
By the same token, if someone doesn't pay a bill for a certain amount of time, I assure you the credit card is canceled. So the issue is, why is 5 years the magic number? If I'm not suggesting it anything to do with what has just been raised by Karen, but rather that if there's a situation where someone is not fulfilling their obligation to renew a license, what about if we were to take and make it shorter and then take the term delinquent and toss it and just cancel the license? I mean, why are we keeping them? For what benefit?
5 years is what's allowed and identified in statute.
Oh,
So that's in statute, that's why it's 5 years, so.
Okay, so that's it. I just couldn't understand. It sounded like a long time to carry something.
Okay, so if there's no questions on the licensing stats, I'll move on. Agenda item 6B is for the enforcement statistics, and then it's on page 50 of your packet. During the quarter, we show that two new complaints were received, and they were both against licensed midwives. No new investigations were opened during the quarter. However, we did have one case against a licensed midwife that was referred to the Attorney General's office for prosecution, and 3 cases were also referred to the District Attorney's office for criminal action. One of those cases was against a licensed midwife, and 2 were against unlicensed midwives. Again, we provided additional statistics for your review. That was just kind of the highlight. Does anyone have any questions?
Could I ask you to repeat, because it looks here under where it says 2012 and 13 that there's no, I don't actually see it even a label for complaints received. What were the number of complaints received that you just gave us?
The complaint, it's on the first line.
Complaints received, first line page.
You're on the wrong page.
Okay, that's what, okay. I have a different form. All right, I now see them. Perfect, thank you. I was just looking at this page that someone
That's
gave us.
6A.
That was a supplemental.
That's 6A. We're
Sorry.
talking 6B.
All right,
Okay, and that concludes my update.
all right. Is there any public comment on any of these 2 items?
Hi, I'm Laura Perez. I'm a student midwife. I was one of the lucky ones who sat for NARM on February 20th, and I believe there were 9 of us sitting, not 8, that day.
Thank you. Any other comment? Any comment from members of the MAC? All right. Seeing no further comments, we'll move on to the next agenda item, which is to set agenda items for the August 8th MAC meeting here in Sacramento. In addition to an update on the midwifery program statistics and an update on the Sunset Review, are there any additional items to be considered? I'm hearing from Faith that she is resigning, so it seems to me we need to put on the agenda a selection of a new applicant, new MAC member. And I would like an update on where we're at in terms of the Sunset Review.
Absolutely.
Any of the other members have anything they would like to have on the agenda? Is there any public comment on this item?
I would really like to have a clarification of what, from the State Health Department, if someone could do it, Health and Human Services, to tell us what information they feel they're missing when we're turning in our annual reports. It'd be really good to know that. So that
I mean, like, what are they collecting from other providers that they're not collecting from us?
or what they feel from information that they need that they don't have.
Can I address the question here?
Sure.
That isn't actually where it's coming from. It's coming from us because we realize as we use that form that there are holes in it. There are places where it's not clear what question is being asked or that there's a lot of slip sliding around as to how you define it just personally. And that there's no way to validate. Like there was a time when there were 5 maternal deaths reported, and we didn't have any way to find out if that was a real number. I mean, how could that happen? How could you have 5 maternal deaths without someone knowing of at least one mother who had died, in which we had 0? And that's just unacceptable as a way to keep statistics. And that's what the issue is. It isn't that the public health department has come to us and said we're having a problem with your statistics. We just need to make them work for midwives and families, period.
And it's also important to realize that we are limited in what information we can gather because the requirements of what we have to gather are in law. They're in statute. And unless and until that is actually changed in law, we haven't got a whole lot of leeway.
Right. Okay, so we're kind of off topic here. All right, so we're going to move on. If there's no further public comment on this last agenda item, then I'd like to entertain a motion to adjourn the meeting.
Seconded. My last official act.
Meeting adjourned.